me.
A few minutes before the top of the hour, as new cases of measles are reported across the country, Health and Human Services Secretary Robert Kennedy Jr. is linking the current outbreak to poor diet and health, along with citing some fringe theories.
Couldn't be that actually in the places where the measles breakouts where they actually
aren't
vaccinating as much.
In a Fox News interview, Kennedy suggested measles vaccine injuries were more common than known, contrary to extensive research and facts. He claimed natural immunity to measles gained through infection also protected against cancer and heart disease, another claim that is completely not supported by any research. However, Kennedy did acknowledge vaccines, quote, do prevent infection, saying the federal government was helping to ensure that people have access to, quote, good medicines, including those who want them, to vaccines. Joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta.
Where do we begin?
Please help us.
Please.
How do we push back, especially since this is the head of HHS? A lot of people are going to listen to this stuff and they're going to take it as fact.
And their kids are going to suffer.
Yeah, well, good morning, Joe and Mika. Here's what I would say. This is to those that might believe this. Here's what he's doing. And this is a playbook he's used multiple times. He takes his preconceived notion, he then misinterprets and cherry picks data, and he makes an outrageous statement, just like he did in this interview. And so when it comes to nutritional or poor health considerations in measles, what do we know? What we know is, as you said, one, the vaccine is incredibly effective, even one dose at preventing infection, much less serious illness. Number two, the only thing that's been really documented here is vitamin A deficiency in places like East Africa, Sub-Saharan Africa, where vitamin A deficiency is prevalent. And so in the case of a young child in those areas, or even parts of Asia, where vitamin A deficiency might be common, yes, if they are exposed and infected with measles, what we would recommend is giving them vitamin A. By the way, in the United States, where vitamin A deficiency, Mika and Joe, is rare, the American Association of Pediatrics, still, regardless of severity of illness, recommends giving vitamin A to a child if they're infected. So this is a moot point. What's interesting and ironic here is that he's linking diet to measles and somehow that this is causative. It's not, as you said in the lead up, but that they already underfunded the Trump administration on day one, basically removed all funding through USAID for vitamin A repletion programs worldwide. So this is an issue that they're worsening, even though I don't think they're connecting the dots.
Dr. Gupta, Molly John Fast here. I'm wondering if you could talk about, it's 5 years since the COVID pandemic. Talk about this anti-vax sentiment and how we got here from there.
Yeah, Molly, I think there's a direct line between the current health secretary being one of the proponents of now vaccine skepticism, all these movements here that has completely reduced public health infrastructure to, I'd say, to rubble here. We're really reliant on private enterprise to step in, pharmaceutical companies, others to step in if there's a bird flu pandemic. To fill the gap, because this is what we're hearing from our highest leaders in government, that somehow there's a link between diet and, say, the measles outbreak. And so this is emblematic, Molly, of the last 5 years of a progressive decline in basic state government departments of public health. One, in terms of the people that are going into it. Molly, I don't know many people who aspire to a career in a department of health in a state or federal level because of what they're seeing. Number two, there is, trust is being removed literally by the minute.
NBC News medical contributor Dr. Vin Gupta, thank you so much. And that does it for us this morning. But
Already?
Guess what?